The first CQM that we're going to cover today is Preventative Care and Screening, Body Mass Index Screening and Follow-Up Plan. The description of the measure is the percentage of patients age 18 years and older with a BMI documented during the current encounter or during the previous 6 months and with a BMI outside of normal parameters. A follow-up plan is documented during the encounter or during the previous 6 months of the current encounter. So I'm currently logged into Nextgen, and I'm going to open up an adult patient. So I have an adult female patient open, age 37 years old, and I'm on an encounter for today, and then I will go down to my templates button and open up my intake screen. So we have the family practice visit type or specialty selected, and then I will go and select office visit as my visit type. And then we'll make sure that we're accessing the intake screen. So your nurse would continue to do the visit as normal and input the patient's vital signs. So let's go to the add button to put in the patient's vitals and first document the patient's height. So we'll say that the patient is 5'4", and we want to make these vital signs outside of normal range. So I'm going to make the patient overweight, and I will say that they weigh 200 pounds. So that gave me a BMI of 34.33. From here, you do have access to the BMI Plan link, but in reality, your nurse is probably not going to be the one to do the BMI plan. It will probably be the provider. So let's save and close. The nurse would continue on with the rest of the visit, and a little bit later, the doctor's turn would be to come in, and they most likely would be going to SOAP. So within the SOAP template, the provider would do their visit as normal, but whenever they get to the vital signs area, they will see that it says vital signs outside of normal range and the BMI is outside of normal range. They can also see the BMI listed here. And let's go into the health promotion plan. So they don't need to actually go into the same screen that the nurse was in. They can go directly into health promotion plan. So we want to document our BMI plan, and the first thing that we need to do is select a diagnosis. And you'll see that there's a lot of diagnosis codes that can correspond with the BMI. So let's select the one that corresponds with this patient, 34. And then we can choose to do diet or physical activity, one or the other or both. In this case, I'll document both. So for the diet, we'll say they're going to have a special diet education. And maybe we educated them on an 1,800 calorie diet and we want it to be healthy and low fat. And for the patient's physical activity, we want them to give them encouragement to exercise. And then maybe we will want them to walk at least 3 times per week for 30 minutes a day. And we can press the add button, and what that will do is it will add it down to the grid so we know it was saved, and then press the OK button. If we wanted to document any additional details as far as the plan goes, the provider could use my phrases. However, they must go into the health promotion plan in order for it to meet the criteria to pull in the report for CQM. Another thing that you will want to be aware of is that some patients can have exclusions. So for this one, the patient could be in hospice. And if that was the case, we could put a referral into palliative care and hospice, and this patient would be excluded from the CQM. There is another screen that I'm going to show you, and this one is for every person, for every measure. It's the CQM results. So within the CQM results, you could select exclusions all and choose to exclude particular patients from different CQMs. So you will see almost every CQM in this list, and you could choose to exclude a patient if for some reason the patient should not be included if they did meet the criteria. So just be aware of this. I'm not going to add any, but we can save and close. And we'll now move on to the next one.